talking about care integration in Finland and in two regions. I think that these two examples I'm going to present now is rather ambitious way of trying to integrate services in health as well as social care. This is not entirely on primary health services, but also covering specialized care, hospital care, and so, as I said, ambitious way of trying to integrate services for people. So first, some policy background facts on Finland. So as everywhere, there is an aging population. There is quite a lot of internal migration as well. There is a rural depopulation going on in Finland, and if you consider that we have public services which is based on municipal organizations, and municipals are arranging most of services in Finland for the people, that means that there are strained in the municipal's ability to organize these services. That's why there's been several attempts, unfortunately failed so far, to reform the health and social services, and as well as regional administration. So even if they have failed, they have, let's say, described the landscape on the direction where to go, and there are certain principles. In most of these attempts to reform the services, there is recentralization, strengthened central stewardship. There is an attempt to create a larger health and social care organizers, or get out of the municipal base of these services, and move towards what is more like a Swedish type of healthcare organizations, so counties. And as well, there is a client-centeredness that is important. But there is different types of underlinings of how to achieve that integrated care, or some have proposed patient choice and competition. There's, of course, the idea that the current system is not sustainable in financial terms, at least in the long run. So some basic facts about the social and health services in Finland. So there is public provided, they are publicly funded. The municipalities, as said, is organizing the services, and they are responsible of organizing both social, health, and specialized care. So. And also the municipal organizations are providing the services. That is important. So hospital services and specialized care services are organized by the hospital districts, which are federations of municipalities. Even if they are federations of municipalities, unfortunately, at least for municipalities and for primary care, they are very dominant by the professionals' strength, and they are political actors as well in their regional areas. So that's why challenging the cooperation between specialized care and primary and social services. Going to these local initiatives to develop integration. So, because there is a stalemate on the national reform, some regions have started to establish new collaboration and trying to make their own reforms in the health and social services. In fact, 8 regions in Finland are so far established this kind of joint authority for organizing all social and health services in Finland. Most of them, or 6, is really recent, so established last year or this year. Altogether, they are representing about 20% of the Finnish population. So they are not really a small scale trials, but really major attempts. Then it's in fact, what has happened is that these municipal federations running hospital services have assumed new tasks, but also they have reorganized their functions quite comprehensively. And for instance, I can show you an example. This is an example of one of these reorganized joint authorities, which is running the health and social services. So there is the same services as they used to be in municipal organizations and hospital district organizations, but they are arranged in a different order. So according to the key clients and according to their needs. So there is family and social services which are providing psychosocial care, promotional activities, health promotion activities for kids and families. There is health service and elderly care, which is providing curative care, but particularly focusing on services old people are needing. So the chronic conditions. And then what is third compound, this is rehabilitation, which is really showing a new thinking. There is lots of strengthening of the rehabilitation and taking that into the new form, also increasing the resources for rehabilitation. So what we are doing is to really run case studies on these two, let's say, a little bit earlier initiatives, and very intensive case studies, collecting material, documents, reports, but also interviewing managers, supervisors in these services, as well as employees, in order to consider the outcomes and assess the outcomes of the service of the reorganizations, as well as considering issues like how well this can be transferred to other contexts. At the moment, we don't have possibilities to present all the services here. We give two examples. One is coming from the services for children and young people, and how they are reorganized. So there is, in one of the areas that is EXO, there is South Karelia Health and Social Care District. They have formed a new unit for services for children and young people, which are combining the services from schools, from hospitals, primary health care and social services, and put that together in one unit, which are operating on walk-in principle. That means that there is no need for referrals. The families or the client is coming in, and then based on interview, it is decided who are the professionals needed for the care of this patient or client. So this is the principles of the service unit. And if we consider the outcomes, they are positive. The service processes have become quite seamless. There is easy access to consultations to specialists because they are working in the same units. There are indications of cost savings, the decrease of very expensive care forms like taking place in the institutions, social protection, child protection institutions, psychiatric care in hospitals, and so forth. What is challenging is that how to organize these services in rural areas. Then, sorry, I skipped the slide. So then there is second example. That's coming from elderly care. There is two very important features in the services. One is that the focus is on home care and rehabilitation. So many of the services which have been taking place in clinics, like rehabilitation services, are taking place at homes of the old people at the moment, and also even a part of the emergency services earlier provided by the hospitals have moved in to patients' home. So there is a mobile acute care unit which can be called to home by the home care worker if that is needed. The home care, and then there are new service forms which are really strengthening these approaches. That is, there are walk-in advice centers, there is strengthened case management, strengthened discharge management, and which are helping to reformulate the service principles of the whole elderly care. And if we consider the outcomes and assessment, particularly the mobile care, acute care, is forming a positive experiences. So the home care workers, as I said, they have possibilities easy possibilities to consult GPs as well as call the paramedics to help if the condition of the patient is needing that kind of interventions. So what has happened is that in fact the care in emergency services as well as in hospitals have reduced. So there is indication of efficiency. Then what is challenging is that it's even in this new form, there is a quite heavy workload for the home care workers. In fact, they don't have possibilities, they don't have time for rehabilitation, which is expected from them. And that is really undermining the new model. Then some conclusions. So, according to our estimate, our assessment, this has been a success story. The unified management works quite well, which is unexpected because this has been a battlefield of professions, or the management has been a battlefield of professions in Finland. The management has assumed the new values, new goals quite easily. There is really a system change in thinking from organizational and professional approaches to clients' needs. There is really a shared understanding of professional paradigms. Then, if we consider challenges, transferability, a big question mark. This is really based on a Finnish system, strong local government. There is public funding, public service provision. Is it possible to transfer to other countries? There is a need for adaptation. Anyhow, as I mentioned, it has been very transferable in Finland, within Finland. That has been assumed already by other regions. Then What is often undermined is the management. There is also need for everyday shop floor level management in order to run the services also in practice. And that is probably one of these aspects which haven't yet succeeded. Okay.
Okay, thank you. Just to clarify, could you just add what made the change coming through? So that municipalities got together, that they created these integrated organizations, and that all these innovative ideas came on the surface.
So there's been a kind of one area which has been innovative, which really started to work already 10 years ago. And they had, as far as I understand, they had challenges with how to organize the services at that area, because they are a rural area. There is, as I said, people are moving out from the rural municipalities, and how these municipalities, they are not coping anymore. They are not able to coping anymore in producing services. They need something. And on the other hand, the integration is not a new thing in Finland. That's been a general, let's say, policy, but not really implemented for a long time. They started to implement that, and it's so.
Is it a bottom-up happening?
Yes. In fact, on the other hand, as I said, there's been an idea to reform the Finnish healthcare system, but that's been politically very difficult, and that hasn't succeeded. So some of the areas waited long enough, and then they started to do something.
Okay, thank you. Thank you for the presentation. We have to move on, and we are moving to Canada.